Hello everyone, and welcome to our presentation for the virtual AMC conference. I am Alexsandra Reynolds, and I am an occupational therapist at Shriners Hospital for Children in Greenville, South Carolina. And we will also be joined by my coworker, Lisa Wagner, who is also an OT here at Shriners. Today we will discuss the COVID-19 pandemic and how it has had an effect on service delivery and how we are optimizing patient care while emphasizing safety here at Shriners Hospital for Children in Greenville. During today's presentation, we plan to address three objectives. First, to identify the importance of telehealth during the COVID-19 pandemic. Second, to identify in-person therapy visits, what they may consist of in regards to our new regulations. And lastly, to identify the social and emotional impact of patients and their caregivers during this unprecedented time. To begin, we'd like to start with an overview about coronavirus or COVID-19, how it's transmitted, and the CDC guidelines that have been put forth to slow the spread and help with prevention. COVID-19 is a mild to severe respiratory illness that's caused by a coronavirus, transmitted mainly by person-to-person contact, contact with infectious materials, or objects and surfaces that have been contaminated by the virus. It's characterized especially by a fever, cough, shortness of breath, and may progress to pneumonia and respiratory failure. It's transmitted between person to person through respiratory droplets. These droplets can land in the mouths or noses of people who are nearby and be inhaled to the lungs. The CDC has put forth guidelines to include washing your hands often, especially with soap and water, for at least 20 seconds after you leave a public place, after blowing your nose, or after you may have coughed or sneezed. If soap and water are not readily available, they suggest using hand sanitizer that contains at least 60% alcohol. You want to make sure to cover all surfaces of your hand and rub them together until they feel completely dry. The CDC also recommends avoiding touching your eyes, nose, and mouth, especially with unwashed hands, and avoiding close contact with others. Make sure to put at least 6 feet of distance between yourself and others outside of your home. They also recommend not gathering in groups and staying out of crowded places. The CDC also recommends that everyone should wear a face covering when they go out in public, for example, going to the grocery store or going to doctor's appointment or to pick up other necessities. Cloth face coverings should not be placed on any children below the age of 2, on anyone that has trouble breathing, or anyone that is unconscious. And lastly, the CDC recommends to clean and disinfect all frequently used surfaces as much as possible to slow the spread of coronavirus. Due to the guidelines put forth by the CDC, there have been a lot of changes in our world today. With these new recommendations in mind, here are some of the new procedures that Shriners has implemented. Masks. Masks must be worn by everyone in the hospital over the age of 2. All staff, medical and non-medical, as well as patients and caregivers, are required to wear a mask for their time at Shriners. You will be given a mask before entering the building if you do not already have one. Eye protection. All hospital staff within 6 feet of patients while providing patient care are required to wear eye protection such as a face shield or an eye covering similar to chemistry glasses. Temperature checks. Once you have arrived at Shriners, everyone is required to have their temperature taken. This includes all employees as well as patients and caregivers. Temperatures are usually taken with a handheld device over the forehead or taken orally. Screening. While you are completing the temperature check, you will also be asked a list of questions regarding your current symptoms, travel within the past few weeks, and potential contact with those that may have contracted COVID-19. Social distancing. Throughout the hospital, there are signs for designated areas for patients and caregivers to stand or sit to maintain 6 feet of social distancing between others as much as possible. Consistent hand washing. As the virus continues to spread throughout the community, it is crucial that consistent hand washing continues to occur. All patients and caregivers are asked to wash hands prior to beginning sessions, and therapists are continuing to be diligent with hand washing before and after every therapy session. Telehealth. Due to restrictions limiting the number of patients allowed to be in the building at once, telehealth visits are now available. Telehealth is when a patient and a licensed healthcare provider interact via electronic communications. You may also hear the terms telemedicine or virtual visits used to refer to these appointments via electronic platforms. New consent forms. Due to this new avenue of providing medical services, new consent forms must be signed prior to beginning virtual.
Let's start by looking at the impact of these new directives with therapy sessions that are most familiar to us, our in-person visits. The time factor is even more critical now, both from a therapist's perspective and the family's perspective. Just like our restaurants and our stores, our hospitals are also limiting the amount of people as we adhere to social distancing concerns. This means that we need to schedule a certain amount of patients at a certain time, as well as our hospital limits only one caregiver to attend a therapy session, and no siblings may come. We want to make sure that you get the most out of your therapy session, so you may find your appointment time on a staggered schedule, such as an appointment at 11:20. This extra time allows for both social distancing as well as extra time for maximizing of our disinfecting process between our patients. From the family perspective, you must also consider time, as you will now need to go through a screening process, which consists of temperature checks, screening questions, and mask dispersal. You need to arrive early enough to complete this process prior to your scheduled therapy time, so you don't lose some of that therapy time. Once everyone has been through the screening process and has their mask in place, our facility has someone escort you to the rehabilitation department for your appointment. For the in-person visit, everyone over the age of 2 is required to wear a mask. This can present challenges to our children with AMC who have limited use of their hands or have difficulty reaching their face to make adjustments. One parent did share a positive outcome of mask wearing in the fact that their child was trying to use their arms and hands more while wearing the mask, as their mouth was covered and they could not access it as readily. We are always searching for adaptive ways for our patients, and yet at the same time keeping them safe. For those children with AMC who use a mouth stick, we made a modification to the mask, as you can see in the photo, where we cut a small hole in the center of the mask and then applied a rubber band around the opening to seal the mouth stick. The placement of the opening is critical, as too high, and the use of the mouth stick pulls the mask down below the nose. But placed too low, the mouth stick then moves the mask over the eyes as the person uses the mouth stick. As we have new policies and procedures in place for our in-person visits, we also have a new way of providing therapy services through the use of telehealth. Let's look at the definition provided by Blue Cross Blue Shield. Telehealth is when a patient and a licensed healthcare provider interact via electronic communications. Telehealth is quite new to many providers. In South Carolina, in our OT and PT Practice Act, telehealth was not considered within our scope of practice until we had the state of emergency with this pandemic, and then the licensure boards allowed the telehealth option for services. These next few slides are information we have gleaned while implementing this new platform of telehealth. Most insurances are reimbursing for telehealth services. We recommend you check with your provider to understand their policies, as the various facilities you visit bill for this service. For the actual telehealth session, there are various virtual platforms available. In order to assure our family's healthcare privacy, our Shriners Hospitals for Children is using Skype for Business. For the telehealth session, the family receives an email invitation in which you have to download the Skype app in order to participate. Although the use of Facebook, Instagram, and TikTok are familiar, these are non-HIPAA compliant platforms. Continuing to be cognizant of privacy concerns, there should also be a signed consent form required for the virtual therapy session. So what are the advantages and disadvantages of telehealth? Although we are coming to you in a virtual setting, telehealth is implemented in the natural home environment. As a therapist, it has been exciting for me to virtually come into the home, and as the child is bringing me their prized toy, I can see the toy and recommend to the caregiver how they can play with it. For example, in order to increase wrist extension. I can use my knowledge base as I see the home environment to recommend ways of implementing the home exercise programs. Perhaps the couch is just the right height to allow for a given stretch into elbow flexion as the child leans on the arms of the couch. Sometimes observation in the home environment brings up more questions as to how they perform certain tasks, and then together we can problem solve how to achieve the greatest independence. In the home environment, we are no longer simulating but implementing it real time. I've had numerous sessions where I've met the caregiver and the child, with their swimsuit on, in the bathroom. With telehealth, we can actually see the layout of the shower. We can practice where to place hooks for the sponges or how to balance a long-handled bath sponge. We can work on toileting skills, understanding if the counter that we need to lean towards or away from is to the left or to the right. From a logistical viewpoint, the use of telehealth decreases the total time dedicated to therapy appointments. The challenges of caring for siblings while you're at therapy, or the actual travel time, the drive time to and from therapy, are lessened as we meet you right where you are. For our children with compromised medical complications, there is decreased exposure and thus a decreased risk when we meet you virtually at home. Being at home in a virtual setting has its advantages, but it can also bring some challenges. As we spoke of our shower scenario, on the virtual screen, I do not have readily access to adaptive equipment or split materials to quickly adapt or modify a tool. While working on movements, as a therapist, I rely on my therapeutic touch and handling to understand the endpoints of those joints or understand the muscles and their activation. For children with AMC, understanding that joint alignment is a challenge to only observe and not be able to feel. Children with AMC are masters at compensatory movements, and in therapy, many times we are working on strengthening muscle movements or developing new techniques for completion of a task, and we want to learn new patterns. It's difficult to analyze the compensatory strategies that the child uses when it's on a 2D screen. At this time, telehealth visits are an option for therapy, and you and your therapist should collaborate to determine if telehealth is right for you. You are always the leader of your team when advocating for your child's needs.
Now that we are able to provide occupational therapy telehealth services, here are some tips and tricks to help you navigate that process. Before your telehealth session, please be prepared to be present for the entirety of your child's session. Please arrive to the Skype meeting 5 to 10 minutes early in order to familiarize yourself with the app, as well as test your audio and video quality. If a caregiver is present who the therapist is unfamiliar with, they will be required to show an ID on screen before the session can begin. As this therapy session is not taking place in a typical hospital setting where medical assistance is readily available, it is important that caregivers have their cell phone present in case of an emergency. When setting up your space, choose a spot in your home that has plenty of space to move around if you're completing gross motor activities, or a sturdy tabletop to complete fine motor activities. It's also important to make sure to minimize distractions for your child at this time. That means keeping away pets and other siblings as much as possible. Treat it like any other therapy session. Make sure your child has eaten before therapy, as well as has enough water to keep them hydrated throughout the session. And most importantly, be patient with one another as we are learning this new telehealth communication together. It is likely that before your occupational therapy telehealth visit, your therapist will send you a list of items that will be needed for your session. These items can range from everyday household items to materials used at the hospital. Provided is a list of items that may be used during your OT telehealth visit. Here are continued lists of items that may be needed during your OT telehealth visits. These items can be used to address fine motor skills, gross motor skills, bimanual manipulation, bilateral integration, grasp and release, strengthening, self-care skills, school readiness skills, and a variety of other activities that can be used to address all of your OT goals.
As we have talked now about COVID and the changes to in-person visits and the new opportunities with telehealth visits, we need to look a little deeper at the social and emotional impact many of the new rules and regulations have had. With only one caregiver being allowed to come for a visit, some parents have shared with us they would feel more comfortable learning if their spouse was with them, as everyone has different learning styles. When new patients come for the first time, there is so much new information from so many different disciplines that having that second set of eyes and ears helps with retaining all the new information at home. Perhaps today is the day that that child stands for the first time, yet only one caregiver is there to experience the joy. Prior to the pandemic, with our new patients in particular, we would invite many family members to come and participate and learn about this diagnosis and the therapy involved. However, now, that family support system cannot be in the same room at the same time. Prior to the pandemic, the amount of social interaction that happened organically in the lobby areas was invaluable, as parents and children met and watched others with AMC while waiting for their therapy session. As we focus on the concerns of this COVID crisis, let's not forget to appreciate some of the underlying emotional impact. As part of a team of caregivers, it is important now, more than ever, to keep an open line of communication. We need to be aware of various learning styles. Maybe more printed materials can be provided. Caregivers can take pictures or video of the don and doff process of braces and orthotics. If there are some challenging questions or discussions, ask your therapist if you can personally FaceTime your spouse so we can all be a part of the discussion. Please seek out opportunities through our support groups such as AMCSI and the supporting AMC Facebook pages. In these unprecedented times, we realize this is a new journey for all of us, and we are doing our best to navigate it with patience and understanding. It is important that each of us appreciate all the different perspectives that are affected with these new guidelines and these new avenues for therapy. Families and children with AMC are already the professionals of adaptation. We hope we have given you a small glimpse into therapy and the adaptations now needed or now happening during this COVID-19 pandemic.